You're very welcome to be on my podcast. You're much needed because of, I think, everything that's happening with medicine. Were you an internist for 10 plus years? So what led you to decide that you had enough and that you were going to make a switch over and do something different with your career?
I never really intentionally left my medical practice. I got really burnt out in 2011 and learned this meditation practice found me. I was never a spiritual type and always very anxious, typical type A doctor. Learned this meditation practice that really changed my life. And I decided after a few years of practicing regularly that I wanted to do my meditation teacher training, which is 3 months in India. And I had this big talk with my boss and I was like, he's like, where do you see yourself in 5 years? And I always thought I'd come back and do a 0.6 FTE doctor and then teach meditation, like back still in Chicago. I never thought I was leaving. And so I told him and he ended up being supportive. And I was like, ooh, I'm disappointed. Like I don't know. I think I was hoping for some big upheaval or something. And then I ended up having the opportunity to move to China, personal relationship stuff. And so I moved to China before I went to, my teacher training was 3 months in India. So I moved to China, went to India for my teacher training. And then while I was in China, it was becoming very clear that personal situation was not working out. And so after India, I moved back home to Atlanta. And by that time, I had been out of medicine for 6 months or so. I was like, I had spent 3 months in India, like barefoot meditating under the full moon or whatever. And I was just like, I don't know who that woman is anymore in the white coat. And I love her. And I was happy enough. Like I was doing the thing, but I just knew I couldn't go back. So I decided not to go back and then started teaching meditation. And I barely actually teach meditation anymore, but I still practice it. And what I do professionally has evolved, but that's what took me away from it without the intention of leaving.
That's interesting. Tell us what you're doing now to help people.
Yeah. So I'm a certified EFT tapping practitioner. Tapping's an evidence-based stress reduction and healing modality, trauma healing modality that I experienced as a human. And then after doing it for a couple of years, decided to be a practitioner. And I'm also an anti-racism and anti-oppression educator and activist. So I do a lot of work in that space, doing some DEI consulting, which has been a bit fraught in the last several months, but probably in the last couple of years has been more and more challenging to do. So yeah, that's the work that I do. And I do a lot of work seeing clients with tapping, facilitating trauma trainings. And I do still teach meditation. I run retreats for women in healthcare. And I think for a while I tried to pretend that I wasn't a doctor. I was like, I'm a meditation teacher now. And then the doctor, like you can take the doctor out of medicine, but you can't take the medicine, whatever. The girl out of the med, whatever. So it was still in me and it's always been a part of who I am.
Exactly.
And I think I realized at some point I was meant to do this in a different, meant to help people in a different way.
What are your thoughts about what's happening with medicine right now and how doctors specifically are feeling about what's happening and the way they're being treated and viewed? I, for one, did not see this part happening where the relationship, don't get me wrong, I have very good relationships with patients, but with my own patients, that is. But the whole doctor-physician-patient relationship has totally changed, in my opinion, for the bad. And it's bad for us because we're both doctors and patients.
Right.
But what are your thoughts about all that?
Do you mean March 2020? What's your...
Yeah. I would definitely include March 2020 onwards. But even before that, things have been changing through the years. Let's say from March 2020.
There's so many things. I think health getting politicized is a huge problem. Capitalism finding its way into healthcare even more and more. I don't know if you've heard the term end-stage capitalism before. Private equity firms buying out hospitals and practices and stuff like that, and insurance companies, all of that. I think treating human beings and their health as commodities. I think the fact that there is not equality in terms of healthcare in our country. And I think there's a lot of, it's funny, when I was first out of meditation teacher training and practicing, I was like, burnout. And there was like a whole moral injury versus burnout thing. And I'm not sure how familiar you are with moral injury or your listeners are validating both of those experiences. Moral injury being the like mental health outcomes of participating in a system that's causing harm for people who like went into a system to help people, and watching these things happen to people watching people be treated in a certain way, the limitations of our healthcare system for people who don't have insurance or who are of different identities, and the mental health toll that takes on people who actually want to be doing good. And so all of that is going to harm everybody, not just the people who don't have white skin. And so I think all of those things together for me are what cause, and the perfectionism, like all of that, perfectionism being part of white supremacy culture, all of that together is putting us as physicians in an impossible position. Yeah. And I just think about all the different factors that were pulling at me. At one point before I left I hate to say I left my practice, but before I moved to China and ended up not coming back, I remember being like, I'm just going to be perfect. I'm going to do everything everyone tells me to do, and I'm going to get all the good scores. So there's like patient satisfaction scores and readmission rate and length of stay, and not overprescribing pain meds and not overprescribing antibiotics, but making the patients happy and listening to the patient and honoring their needs, and education and teaching the residents and the med students, but also honoring work hours. It's like everything we were asked to do is directly competing with it, but we're expected to do it all perfectly. And if there's this like internalized failure as a human. And I just remember being like, I'm never going to be enough. This system I'm never going to be enough to be all the things that the system wants me to be. And there's something so freeing for me of not having to play that game anymore. And I think that's where physician coaches do a lot of great work in helping people escape that mindset, but still stay in their clinical practice, because it's exhausting.
It is totally exhausting. I have to adhere to those measures, quality metrics, whatever you call them. And often it's not a true measure of how you're really taking care of your patients. I've always said, yes, there should be some metrics in terms of patient safety, and I would structure it very differently and not necessarily a 0 to 10 kind of thing, where we need to obviously maintain standards and safety and respect towards patients. But a lot of these things are more like a jungle gym that are put upon us and we can't escape it. And whether patients realize it or not, it often impacts them as well, because we're the ones who are treating the patients, and they don't necessarily always understand the constructs that are placed upon us. The clients, most of your clients, are they physicians? Are they healthcare practitioners? Notice that I never say providers on my podcast. I hate that word, because I do like practitioners because we can practice, and there are all sorts of different type of healthcare people who practice medicine, but providers it's a very impersonal word for me. But the most of your clients, are they in healthcare or are they spread out?
I think in my meditation tapping world, I'd say probably 50 to 60% of my clients are healthcare. And then in all the retreats I had done, I have a retreat coming up in September that's not for healthcare, but previously all my retreats had been for healthcare. Women specifically in healthcare. And in my anti-racism and DEI work that I do, about 50-50 as well. We work with a lot of healthcare systems, but we also work with other organizations.
And specifically your clients that are physicians, how do they find you? How do they seek it out? Is it word of mouth by other doctors who refer them to you? Or is there a way that people find you? Another way, I should say.
I have done a few workplace wellness programs where it's voluntary, but it's like paid for by the institution. And I have found that people get a lot more out of the trainings, I would say specifically with meditation, when they find me on their own, rather than doing it because someone else is paying for it. With tapping, it's a little different because tapping is directly experiential. Like you can benefit from it the first time you do it. Meditation, you have to learn the technique and then you practice it on your own. It takes time to learn it, and it takes time. You practice it and then you're like, even just a few days, it helps, but you still have to practice it. Whereas tapping, it's like I'm doing it for someone, with someone, but I'm facilitating it and they can get the benefits very quickly. And so that tends to be like anyone who experiences it is into it. I would say that generally people find their way to, just the same way I found my way to meditation, or it found its way to me when I was ready for it. People find their way to me when it's the right time. And they'll have heard about me on a podcast or referral, or they'll Google and my retreat will come up. I think people find me who are looking for me. And there's people who in the health physician wellness space who have 150 people at every event that they do. My events are not like that. My events are very small and personal, and there's space for all of it. There's space for everyone. Self-care in medicine, it looks different for everybody. And so there are people who are going to find other people and love them. And so I think there's sort of a little bit of the universe for guiding people in some way. The people who need to find me will find me.
You were saying that you can take I guess it would be the woman out of medicine, but not the medicine out of the woman. How do your experiences as a doctor affect modalities like your tapping and meditation? Because I do practice meditation. I'm probably not at the level that you are, though. But as a doctor, I've noted certain changes within myself when I do practice meditation on a regular basis. I can't say that I do it always on a regular basis, though. But how do your experiences shape those modalities for you?
I like things that are effective and experiential, so people don't have to trust me on it. They can actually do it and get the benefits from it. I like that the things that I teach are evidence-based, and I also like that I teach people to be self-sufficient. Some people come to me for tapping and they want me to guide them through it. It's like a therapy session. So there are people who don't tap on their own and they just want to come see me once a week, or I do Zoom or live in person. But there's other people who just want to learn how to tap on their own. I do train the trainers and stuff. So I love being able to empower people and not have people beholden to me or dependent on me for what they need. So I like things that are quick and efficient and easy to fit into your day. For me as a physician, one of the things that I noticed the most with meditation, I did tapping after I stopped practicing, but I think meditation helped me embrace change more and uncertainty and the need to control things. I'm sure you're very familiar with that need as a hospitalist or any person. You're conducting, it's like a circus or whatever. And all these pieces have to fit together and these tests have to do it and the residents and all this stuff. And if a CAT scan would get canceled or someone wouldn't get discharged the day they were supposed to get discharged, I would just get devastated by it. It just felt like it was tearing something out of my heart. And I eventually started to learn with meditation that I don't actually know what's best. I don't know what's supposed to happen. I think I'm supposed to know, and maybe sometimes I think I know, but I never actually do. There's stuff that we can learn in textbooks, but really it is an art. And so the more I just was able to surrender to what was happening instead of what I thought should happen, that was hugely impactful for me. And I would sit around and see my colleagues getting very upset about certain things, and they just weren't phasing me the way that they used to. Not that I was ignoring them or pretending they didn't exist. I just had a different perspective without even trying. And then with tapping, I think there's a lot of trauma that happens in our medical training to us and in our medical training postgraduate, and that we continue to experience. And we continuously absorb these traumas, either personally or if there's a bad patient outcome or just a sad patient outcome, we carry that with us. And so tapping really helps people to release a lot of that. And a lot of the anxiety, a lot of the perfectionism, tapping really helps people with those issues pertaining to healthcare.
I think we go into medicine and it's very it's different in a way that Eastern medicine, for example, and other alternative therapies. And so even though I'm of South Asian background, I went into medicine as a Western trained physician, and I was like, okay, this is the way things are. You're just trained to believe that, not realizing that there are ancient practices and treatments that have been available well before, not just when you were born, but when modern medicine was born. So that's what I think I was asking at your experience as a Western trained doctor and how you were able to accept or embrace or even view some of the alternative treatments.
Yeah, I was the most skeptical of all skeptics before I learned to meditate. And it's experiential. So I was meditating and I was having these life-changing benefits. And I was like, all right, what's happening? Where have I been? How did I not know about it? And I was never going to be open to it until I was broken enough that I was open to it. And there was this confluence of things that happened in my personal and professional life in 2011 that led to me being open to it. And so because of those experiences, I know for sure that there's stuff that these holes in Western medicine and allopathic medicine I'm not trained in osteopathic, so I can't speak for it, but there's holes that we don't know how to address, but we're still taught that we should know how to address them. And so knowing that I've experienced what I've experienced with meditation and then with tapping, and there's all these studies that show benefits with meditation and tapping, I think it's helped me open my eyes, open my mind to, I don't want to say anything, but I would doubt my doubts before I would doubt a modality. Because I was trained to doubt all. I was trained to doubt chiropractors. I was trained to doubt anything that isn't Western medicine, as if Western medicine doesn't cause any harm. And Western medicine causes a lot of harm. And I think the more we can acknowledge that, the more we can be, being more transparent around it. And our practices help a lot of people and can do amazing things for people, and they can cause harm too.
Yes, absolutely. It is prevalent in Western medicine. And I think a good patient-doctor relationship is where you can acknowledge, let's try all these other things before we resort to medication. But if we do try medication, these are potential side effects and other things to be aware of down the road. So yeah, I often struggle between that balance myself. We've been talking about alternative medicine and tapping and all of that. I know what tapping is, or have at least an understanding of what it is. Why don't you talk to us about it and how it can benefit people?
Sure. So tapping is also called the emotional freedom technique, or EFT. And its scientific name, if you're going to look it up in PubMed or Google Scholar, is emotional freedom technique. So basically, it is a technique that has its roots in both traditional Chinese medicine and acupuncture and modern psychology. And it basically involves acupressure or tapping on different meridians or energy centers or points on your face and chest while saying out loud whatever it is that's distressing us. And in doing so, beyond the fact that it sometimes feels weird to do the first couple times and it looks funny because you're tapping and saying things that are bothering you, it actually activates the parasympathetic nervous system, and it also reprograms the way the stress center of our brain processes stress. So it allows our brain, in a moment where we're feeling, it's like exposure therapy, but very mild, and you're not actually in front of the thing, but you're talking about the thing. And you, by allowing yourself to feel some of that distress, you're then able to tell your nervous system, hey, I'm actually okay.
Okay.
It feels scary, it feels bad, and I'm also actually safe right now. And it can shift the whole way we approach or feel about something that has happened to us or a situation.
That's a great definition of it. I just want my listeners to be able to imagine and understand what that is. So when you do teach or practice tapping yourself, how long do the sessions last for? Is it a 5-minute thing? Is it 10 minutes? Does it go for an hour? How long does it last?
Really depends. There's symptomatic tapping. So it could be I'm sad, I'm angry, I'm activated by something, I'm triggered by something. I just read something on social media that's making me really mad, or I'm really upset that I'm anxious about a social interaction that I had. In that case, you can tap on your own or with a guided video or something for 5 or 10 minutes and get good relief. I also do sessions with people one-on-one, and they come for an hour and we work through bigger issues. They don't just come in and say, I'm sad about this, but some of it's that, but also deeper kind of self-limiting beliefs, helping people get through medical trauma that they may have experienced. Any kind of trauma, we can work through that as well. And that's something, the deeper work you want to do with a practitioner. It involves basically, when I'm working with someone, it's call and response. So I say the thing out loud and then they repeat after me, and we tap, literally it's points on our face, you literally tapping like this and just saying, I'm feeling so angry right now, all this anger. I'm angry about what I read on social media. And as opposed to putting our bad feelings, shoving them away, which we're often taught to do, it allows us to feel our actual feelings and lean into the full breadth of our humanity, because whether we like it or not, we feel all the feelings. We are capable of having them, and we should be capable of having them. This allows us to sit with our feelings and also process them, so that they don't, when we push our feelings away, the bad feelings, they don't go anywhere. They just come back and get to us in different ways. So it allows us to really be with the stuff that's comfortable and then move through them.
Bottle up our feelings, right? Obviously, it can impact us not just emotionally, but physically. Sometimes that's hypertension, increasing our cortisol levels, putting us at risk for heart disease, obviously, diabetes, all sorts of stuff. So there are definitely impacts of bottling up your stressors. So do you often find that, do you see improvements in not just mental health, but also physical health with your clients who practice EFT?
Yeah. One of the things I love about tapping is, besides the fact that it's actually really easy to do, it's very adaptable. You can tap on emotional symptoms or you can tap on physical symptoms. You can tap on the emotions that you're having about physical symptoms. I had a patient with stage 3B breast cancer who's like coming up on 3 years since her diagnosis, and she's doing, I don't take credit for that. She was having nausea from chemo, and we tapped on her nausea, and her nausea got better. She had a lot of trauma from her medical experience. She had a lot of fears and doubts around her cancer as she moved through the recovery. And so we tapped on that. So you can tap on physical symptoms. She was having recurring pain at the site where her primary tumor was. She had a scan and everything was there, but she was still having the pain. So we were able to tap on that pain, and she was better able to understand it and what it might be, the reason it might be there, what it might be there to tell her, knowing that it wasn't actually, I'm not like, oh no, it's your pain is, I always want people to get the health stuff checked out. I'm not
Right.
tapping fixes stuff, but when the medical stuff isn't turning out to be something that's found on a scan, we can still tap through symptoms and often find that there's a message in those symptoms or maybe some sort of meaning or lesson from them. And that can be really helpful. One of my clients is a OB-GYN, and she was having middle chest pain that would come up related to being overwhelmed and stuff. And so we tapped on that. And she was trying to make that pain go away. And she learned to see that pain as an indicator that she's not okay and that she needs to take a moment for herself. And obviously you could be like, of course that is. But the tapping actually shifts the way people think about it. And she came to that conclusion herself through tapping as I facilitated it. She actually was able to connect in with that because tapping opens up this healing mechanism in our bodies. It really allows people to connect into their own intuition in a way that a lot of us have maybe either never been able to do or forgotten how to do because we're just constantly hit with a barrage of stress and taught to disconnect our bodies.
Yeah, in order to survive and move forward. With the EFT, do you have to continue doing it to achieve the benefits, or is it like a certain amount of time that you do it and then you may come back to it again for something different or maybe the same thing?
All the event. There are certain things, like if you tap through a traumatic event, you go through it in such a way that ideally it no longer has an emotional impact on you and is no longer in your body impacting your emotional responses to that trauma and other things related to that trauma. And so we do that. And so it may shift the way people feel about their bodies, or it may shift the way someone, and that's not something that goes away. That's something that is lasting. And trauma is complex, and there may be other aspects of a trauma that come up for someone later that they want to work on. Sometimes you tap on something, and when you're tapping, you have this, it's like a pain scale. You tap from 0 to 10, 10 being the most intense of something, and 0 being it's completely gone. I was trained that we want to get down to 0. What I've really learned over time is that sometimes 0 isn't necessary or desirable. If someone's grieving the loss of a parent, we don't need to get them to a 0. Like, they're grieving the loss of a parent. And so it's, can I get myself regulated? Can I get myself so I can breathe again, so I can care for myself, so I can do the next thing, so I can go see my next patient, so I can be there for my kid or my friends or whatever. So sometimes getting from a 9 in intensity to a 6 is a huge victory.
Yeah.
And we don't need to get to a 0. We'll get there when we want to get there. So tapping is something that you can use once a day, once a week, once a month, once a year, and it still works. Sometimes the results are long lasting and sometimes it comes back, but generally for the most part, it's going to help in that moment to feel more regulated.
I'm hoping that in addition to my regular listeners, that there may be some physicians, and I do know that doctors do listen to my podcast. So I'm curious to know, in terms of trauma for physicians, whether it's coming from the workplace or other stuff that physicians go through, trauma that is, how does it manifest amongst doctors? Do you see certain patterns?
Yeah, I think there's lots of things. There's burnout, I think, and that distancing, that closed off feeling, disconnecting from our bodies, resenting the work. If we get a call or we get a consult or we get an extra admission or whatever, that I think that combative feeling that can sometimes happen with a patient when the patient pushes back or if the patient's being difficult, I think We've probably all had the experience of being yelled at or mistreated by patients or their families. I know I certainly have had that in the hospital.
Yes.
And that doesn't go away. If we don't process it, it'll show up in other ways. We may be more irritable. We may be more reactive. There's a lot of symptoms that are like emotional things that are the result of trauma, but we just think, oh, I'm depressed or, oh, I'm anxious. Perfectionism can be a result of it. Anxiety, depression, physical symptoms, chronic headaches, chronic back pain, irritable bowel, like all that kind of stuff can be a result of trauma. The body doesn't necessarily respond to different kinds of trauma in different ways. Yes, there are going to be times where I want to fight. And yes, there are going to be times where my response is to run away or to shut down. But in my body, trauma is trauma. And so if it's patient care related, if it's training related, if it's a car accident, if it's reading the news, it all impacts us the same way. So it can happen to physicians because we're swimming in this trauma. It happens to other people too. And all of those emotions and symptoms can be present in trauma as well. The depersonalization, going through the motions and not feeling connected, that lack of empathy or compassion that sometimes I think healthcare professionals may feel is a result of trauma. And I think for people who love to care, it can be really distressing to not care, to not have it. I know I felt that way when I had really bad burnout. I was like, I'm going through the motions because I'm a good person and I'm not going to let anyone die right now. But I'm not emotionally invested in this. I'm just doing it like a puppet almost. So yeah, there's a ton of ways. And the way we treat our residents, there's just so many things, because being wrong is not okay. And that's ingrained in us. So when that gets threatened, I think it threatens, this is my personal opinion, we're trained that we're supposed to know. And so when we don't know, that can be almost like an existential threat. And that can feel traumatic as well, even though we're still actually physically safe. To be challenged or to not have the answer can feel, but I'm supposed to have the answer. I'm supposed to know. And so those are some other ways it can come up.
I think there's also, and not to say that this is a patient fault or issue, but I think society, there's an expectation that we should know everything, that we should know exactly what's going on. And especially now with social media and AI and all sorts of stuff, right? The information is spreading so fast, right? At times I have to take a breather just to be able to catch up on all that stuff. And it's obviously not a breather. I'm still doing work. And I do obviously know how to find you, but for our listeners, if we wanted to learn more about you, both the work that you do with anti-racism as well as a private practitioner, where can we find you?
My website's a good place, jillwener.com, and my last name is Wener. So it's JILLWENER.com. And that's going to have everything. And then I'm on Instagram at Jill Wener MD. I'm on LinkedIn, and those are the main social media. I'm on Blue Sky, but I'm not active on it, and I'm off Twitter, and I don't really use Facebook that much for anything. I have professional pages, but I don't use them. Instagram, LinkedIn, and my website.
Awesome. So I'll make sure to include everything in the show notes. Thank you so much for being with us today. It was enlightening talking with you and sharing this moment. And I do think that this will make an awesome podcast when it does come out.
Thanks for having me. I really appreciate it so much.